Your teeth hurt right now and you have access to modern dentistry. You can call a number, sit in a chair, receive anesthesia, and have the problem resolved within hours. For most of human history, that option did not exist. For the vast majority of the time humans have been on Earth, a bad tooth meant weeks or months of excruciating pain, the risk of life-threatening infection, and remedies that range from the genuinely ingenious to the actively dangerous. What ancient people did when their teeth hurt tells you something important, not just about the history of medicine, but about human resilience, creativity, and the extraordinary lengths people will go to when they are in pain and have no other options. Tooth decay is one of the oldest documented diseases in human history. Archaeological evidence shows signs of dental caries in human remains dating back over 10,000 years, to the early Neolithic period. The shift from hunter-gatherer diets, which were low in fermentable carbohydrates, to agricultural diets rich in grains and starches, created the conditions for the bacteria that cause tooth decay to flourish. By the time the first major civilizations emerged, toothache was already a near-universal human experience. The ancient Sumerians, one of the earliest literate civilizations, left behind clay tablets describing what they believed caused tooth pain. Their explanation was the toothworm, a tiny creature that burrowed into teeth and caused the pain and decay from inside. This belief was not unique to Mesopotamia. Versions of the toothworm theory appeared independently in ancient Egyptian, Indian, Chinese, Japanese, and European medical traditions. The idea was so widespread and so persistent that it continued to be believed by some practitioners well into the 18th century. When you understand how tooth decay actually works, the worm theory makes a kind of intuitive sense. The progressive hollowing of a tooth from inside, the way decay moves through enamel and into the pulp, does look to someone without microscopy like something is eating its way through from within. Ancient Egyptians took dental health seriously. The Ebers Papyrus, one of the oldest surviving medical documents, dating to around 1550 BCE, contains detailed prescriptions for treating tooth pain. These included mixtures of cumin, incense, and onion applied to the affected tooth. Other remedies involved henbane, a plant with genuine analgesic properties due to its alkaloid content, pressed against the gum. What is striking about Egyptian dental medicine is not its accuracy, but its sophistication. The attempt to combine multiple ingredients, some of which had real pharmacological effects, suggests a tradition of empirical trial and error over many generations. They did not know why certain plants reduced pain, but they had figured out, through observation, that some did. The ancient Greeks brought a more systematic approach to dental medicine. Hippocrates, writing in the 5th century BCE, described methods for extracting teeth using forceps-like instruments. He also recommended oil of cloves for toothache, a remedy that remains pharmacologically sound. Eugenol, the active compound in cloves, is a genuine local anesthetic and anti-inflammatory. Greek physicians understood, even without germ theory, that infected teeth could cause systemic illness, and they documented cases of dental abscesses spreading to the jaw and throat with sometimes fatal results. The connection between oral health and overall health that modern medicine emphasizes was already intuited, if not fully understood, by ancient physicians. Roman dental medicine built on Greek foundations and added considerable innovation. Roman dentists, known as dentari, performed tooth extractions, created dental prosthetics from bone and ivory, and even developed early forms of dental fillings using beeswax and gum resin. Wealthy Romans had access to toothache remedies that included opium-based preparations, which would have provided genuine relief. Poorer Romans had access to herbal remedies and, when those failed, the extraction. The Roman writer Pliny the Elder documented dozens of toothache remedies in his natural history, including the boiling of frog in vinegar as a mouthwash. Some of these remedies were effective, most were not. But the sheer number of remedies documented by Pliny tells you something about how universal and how relentless dental pain was as a feature of ancient life. Ancient Chinese medicine approached tooth pain through the framework of traditional Chinese medical theory, attributing dental problems to imbalances in the stomach and kidney meridians. Treatment involved acupuncture at specific points, herbal preparations, and the application of arsenic compounds directly to decayed teeth. The arsenic treatment is particularly notable because it actually worked, at least partially. Arsenic compounds can kill the nerve tissue inside a tooth, providing relief from pain even as they introduced the risk of toxicity. This was essentially a primitive form of the modern root canal, discovered not through anatomical understanding, but through empirical observation of what happened when arsenic was applied to painful teeth. In medieval Europe, dental care fell largely to barber-surgeons, a guild that combined the functions of haircutting, bloodletting, and tooth extraction. The lack of anesthesia meant that tooth extraction was one of the most feared medical procedures of the era. Patients were held down, seated in a chair or on the floor, and the tooth was removed with pliers-like instruments with no numbing of the pain whatsoever. The speed of the operator was the primary mercy. Fast extraction was considered a virtue. Some practitioners became famous for their speed. Others became notorious for removing the wrong tooth or breaking the tooth during extraction, leaving the root behind to become infected. What is remarkable is not that people endured this, but that they had no alternative. Pain that you cannot escape and cannot treat changes your relationship to it in ways that modern people, surrounded by analgesics and accessible dental care, struggle to fully imagine. Research on chronic pain has shown that when pain is unavoidable, the brain adapts, not by eliminating the experience of pain, but by developing coping mechanisms, by integrating pain into the baseline of daily experience, by finding ways to function despite it. Ancient people did not have higher pain tolerance than modern people. They had more practice at functioning in pain because they had no other option. There is something in this history that speaks to a fundamental human capacity. The ingenuity with which every ancient culture approached the problem of dental pain, the cloves and arsenic and opium and frog vinegar and prayers to the toothworm, represents not ignorance, but effort. The effort to do something, anything, in the face of suffering. The attempt to find a pattern in what worked and what did not, to pass that knowledge down, to help the next person who would inevitably face the same agony. Modern dentistry, with its local anesthesia and precision instruments and sterile environments, is so effective that it is easy to forget it is a recent invention. The first use of nitrous oxide as a dental anesthetic was in 1844. Lidocaine, the standard local anesthetic used in dental procedures today, was not synthesized until 1943. Everything before that, the cloves, the arsenic, the henbane, the opium, the extraction by force with no numbing at all, was humanity working at the absolute edge of what it knew. Trying to help, trying to reduce suffering, often failing, but never stopping trying. Your toothache would have been their toothache too. The same pain, the same desperate wish for relief. What separates you from them is not biology, but time, and the accumulated knowledge of every generation that tried and failed and tried again, until someone finally figured out how to make it stop. The history of dental pain also reveals something about the relationship between suffering and innovation. Every significant advance in dental medicine came directly from the experience of inadequacy, from watching someone suffer through a procedure that should have been painless, from failing to save a patient whose abscess had spread too far, from recognizing that the current approach was not good enough, and that something better had to exist. The toothworm theory persisted not because ancient people were credulous, but because they needed an explanation, and no better one was available. When better explanations became available, through microscopy, through germ theory, through chemistry, the practice changed. This is what the history of toothache treatment actually is. Not a catalog of failure, but a record of the human refusal to accept that nothing can be done. The ancient Sumerian who pressed a clove against an aching tooth and felt for a moment some relief, and told their neighbor who told their neighbor, was doing the same thing that the chemist who synthesized lidocaine was doing centuries later. Finding what works, sharing it, moving one step closer to the day when no one would have to sit on the floor being held down, while someone with pliers took their tooth out by force. You live on the other side of that day, and it is worth knowing what it cost to get here.